When your patient is presenting hypoxic, tachycardic, short of breath, and they've been with prolonged immobility for a while and they have all of these different risk factors, you immediately need to start thinking of a pulmonary embolism. Now, the key treatments for a pulmonary embolism that you as a new ER nurse must understand differentiate whether your patient is stable or unstable. If your patient is stable, the patient will most likely be on a heparin bolus and heparin infusion. Heparin, as you know, is an anticoagulant that prevents the occlusion from getting worse, giving the body the time to start breaking down the clot on its own. Once you give the bolus, the patient will also go on an infusion. You just have to make sure that you follow your own facility's protocols before starting the heparin infusion. You're going to get baseline coags, you're going to get a baseline CBC to make sure that the hemoglobin is within normal limits, that the platelets aren't low. You're going to look for risk factors. You're going to make sure that there's no acute bleeding occurring. And again, no contraindications for getting a blood thinner. Again, before starting the infusion, make sure that you have a baseline hemoglobin, hematocrit, coags, ensuring there are no signs of bleeding, such as dark stools, prior to the infusion. And again, heparin will prevent the occlusion from getting worse, giving the body the time it needs to break the clot down.